Hello everyone, my name is Tracy Farraher and I'm an epidemiologist at the University of Manchester. I use data to explore what factors are associated with health, as well as differences in health between different communities, and what interventions work to reduce these inequalities. This presentation is part of the European Public Health Week of the 13th to the 17th of May 2019, which is led by the European Public Health Association to raise awareness of public health and celebrate healthy populations. In this first ever European Public Health Week, there are a range of events and activities all over Europe, with each day dedicated to an important public health theme. Each day, I'm going to provide a quick summary of some of the evidence of the health benefits of each day's topic, with links to further information. I hope this provides you with a short introduction to the importance of each day's public health theme. So on the first day of European Public Health Week, the theme is Becoming, Being and Remaining Physically Active, with the motto of the day, I like to move it, move it. The sub-themes of this day are activity-friendly environments, work and health, sickness absence, healthy ageing and social security benefits. But we are going to look at the evidence for the health benefits of physical activity in this presentation. According to the World Health Organization, who have collated a range of data across the world to understand which factors contribute the most to worldwide deaths, they found that physical inactivity was the fourth leading risk factor for global mortality, with it accounting for approximately 6% of global annual deaths. Furthermore, as you can see in the bar chart, risk factors such as high blood pressure and high blood glucose contribute more to overall worldwide deaths than physical activity. But we know from previous evidence that these factors are also associated with physical activity, and so physical activity is a considerable contributory factor to worldwide mortality. It's also interesting to note that risk factors that traditionally have been concentrated in high-income countries, such as cholesterol, physical activity and obesity, are now found in low-income countries. The WHO reports were able to be collated because of the considerable body of evidence that has been accumulated over 50 years around physical activity. One of the first studies was by Morris and colleagues in 1953. They looked at bus conductors, bus drivers, office-based workers and postmen, and found that those with the more active occupations had lower rates of coronary heart disease and on average smaller uniforms. Over the last 50 years, the evidence has increased and looked at a range of health conditions in relation to physical activity. And the benefits found over the last 50 years have not only included physical health conditions, but also looked at mental health. The 4 chief medical officers of the UK collated the evidence in relation to the benefit of physical activity, as well as how to improve the rates of physical activity in the UK. In that report, they outlined the range of benefits from physical activity, such as improving sleep and quality of life. But in some cases, they were able to be more specific about the risk reduction as a result of physical activity. For example, based on the systematic review of previous evidence, it was found that the risk of getting conditions such as diabetes, a major cause of poor health and early death, was reduced by 40% by increasing physical activity levels. Moreover, it was also found that the risk of conditions such as falls, dementia and depression were reduced by approximately 30% by increasing physical activity levels. So physical activity has significant benefits for health, both physical and mental, and it has been found to prevent and manage over 20 chronic conditions and diseases, including some cancers, heart disease, type 2 diabetes, and depression. Thank you so much for your time. Further information on the benefits of physical activity and how to improve your physical activity, as well as today's sub-themes, with listings for the events for today and the rest of the week, can be found at the European Public Health web pages at eupha.org. There you can also find links to my other evidence summaries. To get in touch with me, I'm based at the Division of Population Health, Health Services Research and Primary Care at the University of Manchester in the UK, where I'm also a member of the i3HS Hub that aims to improve population health through data sciences. You can follow the Hub and myself on Twitter at i3hsh and at tfarraher. Again, thank you, and I hope you found this quick summary of some of the evidence of the health benefits of physical activity useful. Keep moving.